Drainage of a pulp. Space infection. Felon drainage. This video has been produced from a book source. We would like to thank editors Stanley Hoppenfeld, Pete DeBoer, Richard Buckley, and we would like express special thanks for the medical illustrator Hugh A. Thomas. Distal finger pulp space infections are the hand infections that most often require surgical drainage. Infection is usually caused by a penetrating injury to the pulp, an injury that may be quite trivial in itself. Superficial infections cause skin necrosis and point early, usually on the volar aspect of the pulp. Deeper infections are more likely to cause osteomyelitis of the underlying distal phalanx, a condition that is known as a Felon or Whitlow. Depending on the depth of the infection, two different techniques exist for draining pus in this site. 1. If the abscess is pointing in a volar direction in the distal pulp of the finger, as it commonly is, make a small incision on the lateral side of the volar surface and enter the abscess cavity obliquely. Midline incisions may produce painful scars. 2. If the abscess is deep, the surgery described below may be necessary. Incision. Make a straight incision on the lateral aspect of the terminal phalanx of the finger, extending to the tip of the finger close to the nail. The incision should not extend proximally to the distal interphalangeal joint. More proximal incisions may damage the digital nerve, causing a painful neuroma, or they may contaminate the joint with purulent material. The incision should be dorsal and distal to the distal end of the distal interphalangeal crease, figure. It should not extend distally beyond the distal corner of the nail. Avoid the ulnar aspect of the thumb and the radial aspect of the index and long fingers to avoid creating a scar that interferes with pinch. Superficial surgical dissection. The pulp of the terminal phalanx contains numerous fibrous septa that connect the distal phalanx with the volar skin, creating loculi. The infection easily can invade several of these loculi. To ensure that all pockets of infection are drained, deepen the skin incision transversely across the pulp of the finger, remaining on the volar aspect of the terminal phalanx, until the skin of the opposite side of the finger is reached. Do not penetrate this skin. See figure. Now, bring the scalpel blade distally, detaching the origins of the fibrous septa from the bone. Proximally, take care not to extend the dissection beyond a 0.1 cm distal to the distal interphalangeal crease, otherwise, the flexor tendon sheath may be damaged and infection introduced into it. Dangers. Nerves. The digital nerves may be damaged if the skin incision drifts too far proximally. Painful neuromas can result without an appreciable area of hyperesthesia on the finger. Muscles and ligaments. The fibrous flexor sheath of the profundus tendon may be incised accidentally if the incision is carried too far proximally. Special points. The fibrous septa that connect the distal phalanx to the skin make this an ideal site for loculation of pus. Take care to open all the loculi so that adequate drainage takes place. Unsuccessful treatment of a deep abscess may result in osteomyelitis of the distal phalanx. Thanks for watching. Thanks for watching. Subscribe Orthopedics Trauma in YouTube.